All right, Nico, can you say, welcome to another episode of Healthy Births, Happy Babies?
It's a happy episode. Happy babies.
Welcome to Healthy Births, Happy Babies, where we share tips, tools, and stories grounded in natural childbirth and parenting principles, so that instead of feeling overwhelmed and confused during this exciting time in your life, you feel safe, supported, and empowered in your childbirth and parenting journey. And now, here's your host, Dr. Jay Warren.
Hello, yes, I am Dr. J, and yes, this is the Healthy Births, Happy Babies podcast. And yes, that was my son introducing the show at the top of the podcast there. Got to get that co-host of mine trained up a little more, reading his scripts better. Well, got to teach him to read first in the first place. But today's episode is going to be a great one. We're going to have a conversation with Dr. Jonathan Evans. He's an osteopath out of Australia that specializes in treating infants and babies, and I've actually been learning from him for the past year. He has online courses teaching practitioners, not just osteopaths, but other body workers, chiropractors included, on what he's learned and how to work with kiddos even better to get them better results. And so I know that he has a wealth of knowledge to share with you today, but it's not going to be in a practitioner sense. It's more of these are the types of things that he as a practitioner sees and the common problems that can be helped with. But even more importantly, what he's going to share is a program he's put together for parents specifically, not just practitioners. It's a way of assessing your own baby and working with your baby to help them unwind tension, and then also giving feedback of if it's not unwinding in this certain way, then you know where to be able to take your kiddo for help. But it's a great way for parents to start working with your own babies, not necessarily in a clinical sense, but putting your hands on and touching them and loving on them and helping their bodies do what they're designed to do, which is to release tension if it stores up and to be healthy, because that's a natural state of the body. So I'm excited to share this information with you. I'm really happy that Jonathan's come here or online to be able to have this conversation from all the way across the world. But first, as always, let me take a moment to take a word from our sponsor, the Cap Wellness Center.
Hi, I'm Maring Higa, and I'm the acupuncturist at Cap Wellness Center. One of the things I love about working at Cap Wellness Center is getting to be around all the brave, strong, and inspiring women. I'm always inspired by my patients' ability to rise to their challenges, overcome obstacles, and also get creative in their pursuit towards their health goals. I feel honored to be a part of their journey, whether it's helping them to start a family, have a healthy pregnancy, or helping them through their postpartum recovery.
All right, and with no further ado, let me introduce our guest and move on to our conversation. Dr. Jonathan Evans graduated from the British College of Osteopathic Medicine in London with first-class honors. Then in 2005, he moved to New Zealand and gained invaluable experience in a rural practice, seeing a huge variety of patients. But then in 2010, he moved to Australia to focus solely on the treatment of babies and children. For the past 10 years, he's been passing on his knowledge to other osteopaths by teaching in universities in Australia and New Zealand and through postgraduate academies. And this all led to the foundation of Kindred Academy in 2016 and Parent B in 2017. So those teachings could be accessible outside of the osteopathic world. And as I said, that's how I got to know Jonathan and his work and how he came to be here today. So let me switch now over to my conversation with Jonathan. All right, Jonathan, welcome to the podcast.
Thanks, Jay. Welcome. It's great to be here.
Yeah, I'm really excited to have you on the podcast because I've actually been learning a ton from you. I have your kind of starter kit of working with babies through your Kindred Academy, and I've learned so much in this last year. And just following you from Facebook and all the value that you give to us docs, I know how much you have to share with us that our parents can also benefit from that as well. So I appreciate you taking the time all the way across the world to be here to chat about your expertise and help our parents.
Thanks, Jay. It's a pleasure to be here.
Yeah, well, and you've been doing this for a long time. I mean, we read your bio, so we understand kind of your background and how you found your way to Australia. But how did you find your way into working so intently with just babies and kids?
Well, I guess you hear a lot of people tell stories about that when they grew up, they always knew they wanted to work with, people and help people. And I wasn't like that at all. I was a bit of a troubled teen. And so, my early years were dominated with kind of focus on myself and getting myself sorted. And there wasn't a lot of time for other people. I suppose it's something that quite a few kind of boys struggle with. And it was only in my late 20s that I kind of did a bit of a turn. And I had, I'm doing well in terms of professionally with my job. And so I had a bit of money and a little bit of a chance to kind of reflect. And then gradually it was like, wow, I don't really want to do this. I was working for Merrill Lynch at the time, actually, in London, corporate banking, computing. And it was, kind of became to the point that I didn't want to do it. I wanted to do something a little bit more with my life. And that's how I gradually shifted into osteopathy and, training as a doctor. And then that just, I guess, as you get older, hopefully this is what happens, you mature a bit more. And I remember, it's only probably the last 2 or 3 years that I've looked back and not gone, oh my God, did I do that 6 months ago? You look back and think, oh my God, that was cringeworthy how immature I was. And, so I think that gradually, I got into working with patients, and that was great fun. And then when I was working in New Zealand, I was working with an osteopath who was really brilliant with children. And I started working in that field. And it was only when I started working in it that the joy of that came through. When you work with adults, sometimes you get a bit frustrated, and that's your own frustrations because you can't make the change you want to make. And with babies, you don't have, they're not as fixed. And so if you don't make a change, it's yourself. And that you've got to work harder to get that change. Whereas adults, sometimes it's like, was that me? Or was that, the adult not really wanting to, or being in a position to change? They've got to work as a bricklayer, for example, and lay 1,000 bricks a day. Well, their back is going to struggle with that no matter how much we help them in terms of treatment. And with babies aren't like that. They aren't out laying bricks all the time, which makes it easier for us for sure.
Absolutely. And with seeing so many kids, what are the typical things that parents bring their kiddos in to you for help with?
Well, I think with the older age group, there's a lot of physical stuff, injuries and sporting things like that. But also, and I think this is a little bit where people have to get used to it. Often you'll get people ring up. I'm sure I don't know if it's the same with you, Jay, when I can't bring my child in today, they're sick. They're coming in for maybe back pain or a problem. And then we always say, no, bring them in because we can help with that. And then when they come in and they see, for example, you might lay a child down and they're very lethargic, when they're sick, whether that's a 2 or 3 year old or a 10 or 11 year old, they're in that kind of, Yeah. And, and we treat them. And then halfway through the treatment, you see that child kind of pick up and become sparky. And it's really funny with the toddlers because at 2 years old, they want to run around and cause a bit of havoc. And so when they're in that kind of sick and lying there, they're easy to treat. And then halfway through the treatment, as they perk up, they then start to cause trouble. And you're like, try and keep them on the bench there. And so when parents see that, it's like, wow, okay, there is stuff we can do with that. And there's evidence that they see from what happens there in the treatment. And so we get a lot of children now that come in for sickness, for that they're just recurrent illnesses, coughs, colds, asthma, all those type of things. So there's quite a wide variety of different things that we see. And then in the younger age group, in the babies, it's the classical. And I was talking to one of my osteopaths. I was doing a training session for last week, and the first time she treated a baby, actually, that day was the very first baby that was coming in to see her. And I said, look, it's not like an adult. An adult, you don't know what they're coming in with. Basically, I can pretty assure you this child is either coming in for colic, reflux, sleep problems, pooing problems, or a flat head. And, as sure as eggs, that's what it was with one of those. So that's really what I see in terms of babies. And, that might be linked to a birth trauma or difficulty baby in the womb or some other particular thing. But that's really what mums and dads are interested in. Solve one of those problems for me.
Right. And I don't know how it is in Australia. Here, it's definitely catching on for babies to be worked on by osteopaths or chiropractors. How is it there in your country as far as it being accepted or even thought of that you as an osteopath would be able to help a baby with sleep problems or colic?
Yeah, no, that's a good question, Jay, because in the UK where I trained, it's a lot more well known, and it was pioneered very much by Princess Diana, because when she was alive, she was so much into kids and charities and helping children. And there was an osteopath there, Stuart Korf, who's been working with babies for a very long time, and he's a very interesting character. He's kind of we call him posh, should we call him? In that way that sometimes the Brits can be. And he got on very well with Princess Diana, and they talked about these things. And so she was helping in terms of what happened with the children's osteopathy in the UK and the Osteopathic Centre for Children. And so it became very popular. And in Australia and maybe in America, it's not quite as well known. And definitely in Australia, what we're seeing here is this polarization between there's certain people in authority that don't like it. They think it's a bit weird and it's a bit wacky, and we shouldn't be doing that. And then there's obviously, if you like, I would call it the Oprah movement. It's like, if you think about how much things have changed in the last 20 years, whether it's for children's health or for how we can do things in life and make things better for ourselves, and not just go with what the authorities say. And I really think Oprah is a really big part of that. It's about, hey, we can do all of these different things. And so, we're seeing that here in Australia as well, where people are going, no, I want to take charge of my life and do what's best for me and my children. And if that means go to an osteopath or a chiropractor, I'm not going to just go and do what the drug companies say, which, we did for a very long time. It was, drugs that do wonderful things for us. But equally, people see that, perhaps they're after our money just a little bit as well.
Exactly. And I know, like, with the internet changing things so dramatically over those same 20 years, that parents that are having these problems, that maybe 2 a.m, they're Googling things and seeing things where, okay, an osteopath has helped me with this, or a chiropractic has helped me. And so they have more resources to try things out for the little ones, and having just 2-3 weeks into their baby's life being able to get this kind of help rather than, unfortunately, going a couple months or maybe even just surviving that first year, and then those challenges that could have been corrected move on into other physical challenges for the babies. So it's impressive in my own practice just seeing how many people are doing exactly what you said, like taking charge as parents. And the kind of traditional lines aren't really how they want to raise their kids, or the way that they were raised medically wasn't the way they want to do it, and they're trying different things out. It doesn't mean it works for every single person, but at least it's a more natural way of getting at the root cause of what's going on.
Yeah, definitely. I mean, I think osteopathy and chiropractic has so much to offer all ages of life, but particularly in that young age group, because when we're older, if we've got a back problem, well, you can take a painkiller, right, or you can do that kind of thing. If you've got a migraine, you can take Immigrant and these drugs, and there's nothing wrong with that. Sometimes that's a little bit of a band-aid, and we want to look deeper than that. But that's still part of life and part of the weapons people have to help with their health. Whereas when it comes to babies, and certainly in pregnancy as well, we don't want to. There aren't that many drugs we can give babies and during pregnancy. And equally, we've realized that's not what we want to do. We don't really want to do that at all. Even if it's for reflux, people hate giving their baby drugs for reflux. Sometimes they have to, but they really kind of inside go, they don't want to do it. They want another method of approaching that. And that's why, what we do really is, and why it's growing so much. People go, yeah, great, I can do something. I can do something else for my child. And we were talking a little bit earlier before we came online, just before we got going. And that's why some of these things that we're doing, we're trying to put them online so that people have these opportunities. It's 2 a.m. What are you going to do? You can't see the chiropractor in 2 a.m. You can see them the next day, but not then. So if you've got stuff you can do at home, and that's something, I'm looking at the moment, so that to educate parents so that they've got this armory, that they don't feel helpless. Because, I remember the very first time I felt helpless in my life was when my first child was born. My wife was giving birth, and we needed to be at a hospital because we had a few complications, and I was just completely helpless, and that was terrifying. And I'm sure if any dads are listening, they'll resonate with this. You're completely powerless, and it's a really, really uncomfortable feeling.
Yes. And, the more information we have, the better, but also having then tools that are actually actionable is even better, especially 2 a.m, right?
Yeah.
And
Yeah.
that's why I'm really excited for you to share what you've come up with the health check that you can teach, that you do teach your parents, so that they can, one, assess and see if something needs to be done, but then you're also teaching people how you can help the babies with that. So share more about what you've created.
Well, it came out of the fact that when I work with babies, I try to do really practical things for mum and dad and practical things for baby. And you can do all these things, work around the head. There's something called cranial osteopathy, which is working on the cranium. And that's awesome. You can do a lot of work with that. But you can also do really great things just with simply moving the hips, moving the spine, moving their arms. And if you think about, like in an adult, if they fracture their arm and they're in a cast, when you take that cast off, let's say their elbow is at 90 degrees, then that arm is really stiff because the muscles are tightened up and the brain has learned that, right, we're going to hold it in this position. It's been in this position for 6 weeks. And that's why you do all those exercises to open that arm up. And if you don't, that arm will stay fixed and locked like that forever. So if we think about a baby, and a baby's been, particularly late in pregnancy, last 2-3 weeks, they're not moving as much, then they're going to get locked into this position. And we add in birth trauma, and there's other kind of forces locked into their body. And so if we don't do anything with baby, then they tend to stay in that pattern. And it's interesting, even now as we're doing this podcast, I've got my one ankle crossed over the other, and it's always exactly the same, right over left, right over left, right over left. That was 50 years ago, and I worked out that must have been the way I was in the womb. So not only is there some physical tightness still that's left 50 years later, not enough to stop me playing rugby and sport, but just a bit, but also there's a psychological comfort. So we'll go back to these positions that are comfortably physically, but also comfortably in terms of what it makes us feel. Oh, I was like this in the womb. Baby was turned to the left and their arm was tucked up and their one leg was tucked over the other. So they will keep dropping into that position. So once I realized that with babies, I started to work a lot with opening up those patterns and then showing mum and dad, hey, look, you can take hold of the hips and you can take hold of the arms and do these stretches. And some of them they've already naturally were doing, like they push their knees up and down like that little bicycle. And it's just teaching them what to look for. If you look at the little things of what's happening, the little signs from baby, then you get to communicate with baby and you know how far you can push that. And you can, first of all, check to see if there's any issues. And that might mean you then take them to the chiropractor, take them to the osteopath. Or, that's what I'm also developed was that program of stretching so you can start to work those things out so that you can get baby to be balanced evenly through the hips and through the lower limbs and through the arms, through the spine. And that's not just great, making them a great sportsman when they're older and they can run faster than everybody else, but it also has a direct influence on colic and reflux and sleep. So if you imagine your back sore, you don't want to sleep on your back. Well, of course, we've been taught, which I disagree with actually, but we've been taught, oh, baby must lie on their back. Well, of course, now we've got a baby lying on their back. What about an adult lying on their back when they're uncomfortable? You're going to complain, aren't you? And this is what happens. And same with colic and reflux and all of these issues. Yes, they can be complex issues, but sometimes it can be physical tightness through the gut wall, through the hips, through the back. That's actually the difference between baby overcoming that, in a few days, in a week, as opposed to it going on for 6 weeks longer, then they're on drugs, then we're getting the worries about that. So that's kind of where it came from. It was seeing the benefit from the kids that came in, but also the parents coming back going, in fact, they didn't come back and tell me they were doing these things, but I'd lift the arm up the following week or the hip. I said, wow, that's doing great. They said, oh yeah, we've been doing our exercises. Because I don't know about you, Jay, but how many of your adult patients do their exercises?
Yeah, not very high percentage in compliance.
Yeah. I stopped.
I get more of this that are like, oh, I know, I should be doing that, but I forgot.
Yeah. Well, you're like my sister. When I lived with her in London in a flat, and she's a judge, and so she's really, very, very busy. And I said, what are you doing? She's doing like this massive, intense program of exercises and it's packed into this 20-minute period. I said, what are you doing? She said, oh, I'm off to see Steve. Steve was an osteopath friend of mine. He treated her, not me. And I said, well, why are you doing that? Well, I haven't done my exercises for the last 3 weeks and I'm trying to get them all in now.
At least she's doing something, right?
Yeah, so at least she's doing something. Yeah, exactly.
But then with
so,
parents, they tend to be a lot more proactive with their kiddos, right?
Oh, yeah.
Because they're so dedicated, and I love that.
Yeah, exactly. And it's not just that. It's not just that they love their children. It's that thing we talked about earlier, where it is empowering someone. They feel, oh, I can do something about that, and they know if they do those stretches every single day, then that's gonna help the reflux. It's gonna help the colic, and it's gonna help all of these different things.
Well, and I think that's important. Like some parents are very in tune with their kids and touching them, and at the same time, they might not know what to feel for. But then other parents might be a little afraid being around their infant. It's their loved one, of course, but if they're not familiar with an infant, they might feel like they're going to break them or hurt them. So how do you kind of work with the parents to have them become more and more comfortable with kind of playing around with their kid or moving them around, doing these stretches that could be so beneficial for them?
Yeah, no, that's a great question as well, because we first have a baby and we're holding them like this piece of china. We're afraid that they're literally going to break in our hands, and that's naturally because I always think having a baby is like being given an alien spaceship to drive with no manual. It's like, right. Well, hang on, there's not even a steering wheel. What do I do? And then, you kind of work it out. And then you have your second child. You think, yeah, I'm all over these alien spaceships. I'm great. And it's like, oh, it's come from a different race. It's a different alien spaceship. My God, what worked for that one crashes this one. So, that's very much that fear is justified. And so I think the way the answer to that is to talk about it, to make people realize that, hey, actually, it's just about practice. Yeah. And so, all of the things we do in the baby health check and the stretching are actually less stressful for baby than when you change baby's clothes. And if there's any parents out there listening, whether you've got a new baby now or you're an older parent that, remembers back. Remember the first time you changed your baby, tried to get that arm in or out of that outfit? It was like, my God, we were lucky not to dislocate the shoulder. We were exactly. So clumsy with it. So, there's not anything even as stressful as that. So that's the one aspect. And the other aspect is, video. You were talking about some of the courses that you did of mine. The video is the key because, podcasts are great like this and we can stimulate the mind, but a video shows you exactly what to do. So, there's a walkthrough of the video of everything I'd like mum and dads to do. And then we break it down so we can show the stretch and the health check. And then I go back through it again saying, look at baby lift arm. So when we do a little stretch, you'll see a little twitch of baby's arm or a little sound. And so it's those little cues. As soon as you've shown them on a video, it's like, wow, that's obvious. But once you've shown them, you get to learn, and you get to learn baby's little cues and signals. A little raise of an eyebrow in one baby or a slight change of color. And even if you don't do any of the actual health checks, you're not interested in that, just seeing how baby communicates with their language and their body language is just really significant.
Well, and I think all the parents that I work with, they're all wanting to give their kids every advantage possible. And they, as you just said, they want to know they're doing something. And they want to do something right, of course. But sometimes just doing something is enough with the right intent. But having this kind of tool, and I didn't know anything about this check that you have available for parents before we got on. So I'm even more excited that this is something that parents can actually see and learn to do, because this isn't going to just help them as infants. This will carry on all the way throughout, like toddlerhood and into their years. And that's why I'm so passionate about working with kids, because there's so many little changes we can make at the start of their life to help them heal from the prenatal environment and through birth trauma that will then allow them to grow into their fullest potential, because these blockages are out of the way. And if even more so, what you're doing is educating parents on how to do this proactively at home, even more often than they be able to come to our offices, then look out. These kids are going to be really, really far advanced.
Yeah, no, I think it's just something that because we look around what's happening in the world at the moment, it's very easy to get gloomy. We talk about global warming and we see all the terrible things that happen around the world, and we're bombarded with that in social media all the time. And so it's like, oh. But on the other side, if we look at education and we look at health, we're actually making great advances. And so I just see this as part of both that health and education, and that we can do so much more. I mean, look at education in 30, 40 years ago, you didn't have dyslexia, you were thick. And then what happened is we discovered dyslexia, and, the head of Microsoft and the head of Oracle, all these software companies, they're all dyslexic kids, all gone into computing, and they probably would have been shoved in the corner 10 or 15 years before they went through their schooling and had the big, dunce hat on them. And we're seeing that now with other stuff as well. I do a lot of stuff with learning difficulties with children as they get older. And you probably know about this, Jay, sensory processing and how we take in the senses, how we hear. Not just do we pass a hearing test, but what happens to the hearing once it goes in the brain and gets processed. We're making great advances in those kind of things and understanding that. But if we can back up the line even further and deal with some of these birth traumas and some of these things happened in these early months and early first year or two, then we'll just see even all of that just boost even more. We see that the stuff I see with kids, I see a huge glut of kids about 5 or 6 years old because they go into the school and they're struggling. And until then, that 2 years, we get the colic and the reflux and all of that, and then the babies work through all of that. And then there's this period where parents are struggling with children, but they just think, oh, well, that's just my child. And then they go into school, and then suddenly there's a problem because the school is saying, hey, this little boy's not doing this, and they won't sit still, or they're not learning, or they're just struggling in X, or we're unhappy. And so then we ended up putting labels on them, ADD or ADHD or autism, all of this. But a lot of that comes from those early years. If we get in on an earlier stage and we help baby before they get to school, then we don't get those struggles so much. And you also don't get those labels, because what happens is once a child starts getting labeled as a troublemaker or they know they don't fit in, then they start to play up, the classic, and they might become the joker, the humorous one in the class, or the troublemaker, or the bully. So a lot of the things that we see later on down the line in teenage angst and all this stuff, we get in early, it's just such a difference we can make.
Yeah. And so, with, say, new parents that have a brand new one in their arms, I mean, obviously, like through a podcast, it's audio, as you mentioned, it's hard to, you can't visualize it, but what's one thing that you could share with a parent listening to this that they could look for or do with their kiddo that's, very gentle and non-invasive, but can help their kiddo out?
Well, I think probably at that age, even at 1 or 2 days old, if you put your baby down on a pillow, you'll just see that they'll go into a natural position. And in fact, if you put them on a pillow, sometimes you have to be careful because they'll actually roll off to one side. And so that's the side that they're tight. They want to go into a left curve, or they want to go into a right curve. And they'll have at that age, a couple of days old, they'll probably have their knees tucked up, and you'll see the one foot tucked over the other foot. And so that's their birth pattern. Now, we don't want to kind of yank them out of that because that's where they're comfortable in. But even, at this stage, if you take baby's legs and just open them up just a little, just pull them down a little bit so that we're not getting those knees tucked up, and take that one ankle and try and tuck it the other way around, even that is starting to undo the stretch at that stage, even though you're only doing a tiny amount. And then you listen to baby. The other key is to listen to baby. If you do that, baby's sound asleep, they're probably going to go, and start moving. Well, okay, that's saying not now, not at the moment. So then even that day one, you're in there and you're starting to connect with you and your baby on this physical level and understand how their body works, and also on a communicative level, and understand what some of their sounds make and what some of their sounds mean, I should say.
Very nice. Well, in our last couple minutes here, first, tell people how they can learn more about your program and where they can reach out to you.
Well, I've got a few websites, because we've got one for clinic and one for teaching practitioners, but the one that interests the listeners most is www.parentb.com. That's B-E at the end.
Okay. And that's where, landing on that page, they'll be able to find links for this physical health check?
Yeah, we've got the physical health check there and the stretching for babies there as well.
Okay.
And they're starting to build that website out. There's a little video, a couple of videos there on posture in children and that whole kids and computer terrible conundrum that we're going through at the moment.
Right. And mention your website too for the practitioners, because we do have practitioners that listen to this trying to learn as much as we can to help more babies.
Sure, that one's www.kindredb.com. Again, BE at the end.
BE.com. Okay, and I'll make sure those links are available in the show notes as well as on the page that we set up. I'm on Kindred B myself, like learning from you all the time with the different modules you've set up. And because I know the high quality teaching that Jonathan has done for me as a practitioner through the Kindred stuff, I know this Parent B program and the physical stress will be a high quality one as well. I'll be sure to get it as well so I can learn myself more and then also be able to pass it along to the parents that I work with. So thank you for creating that, Jonathan, and just thank you in general too for everything you're putting out there. I want you to know that the work you're doing and the videos you've created by me learning from it has allowed me to help a lot of babies that I see. So I want to thank you for that, one personally, but then also from the parents of the babies and from the babies that have been helped as well.
Thanks, Jay. No, it's a pleasure to know that the work is getting out there, and that's kind of why we're putting it online. It's similar to you. It's like you can only see a certain amount of people in person. Yeah. So, how do we make a bigger impact? How do we help a little bit more?
Excellent. Well, so with our last minute, what's the major take-home message you'd like a parent listening to this to get from our conversation today, or maybe just something else, a message you'd like to pass on?
No, I think there is a specific message because, like yourself, I see parents all the time, and so you hear, the difficulties that parents have, and parenting is getting harder, I think, definitely. And so I just say, look, be kind to yourself, because there's all these things like these tools that you can get the physical health check, and you can take your baby to the chiropractor and the osteopath, and you can do all of these different things, but you just got to be kind to yourself, because parenting is a joy, but it's also a real terror. It's the terror of trying to do it perfectly. Right. And you just won't do that. You look back at the parenting you had, that your parents gave you. It wasn't perfect, but you're here and you're present, and this is the best effort you can do. So just always be kind to yourself and be kind to the people around you as well.
Right. And what about a message for the little ones, like whether a baby's not born yet and parents are listening before the baby's born, or if they're in mama or daddy's arms right now listening through them? What message would you like to whisper into their little ear?
Well, that's an interesting one, because if anything, I think babies should be whispering in our ears and telling us what to do, because, I think what we are is when we come in as a baby, we're the wisest that we'll ever be in our whole life. And you look at a baby, you look into a baby's eyes, and you hear people say, oh, look how old they are. They just see that depth in their eyes, because, we come in perfect, we're absolutely perfect. And then we just get dumber day by day by day. Especially for boys when they hit the teens, So I guess what I'd say, I'd whisper in their ears and say, even though when you grow up, but just stay baby inside.
Oh, that is such a sweet message. Well, thank you again, Jonathan, so much for being here and sharing your wisdom, and then also from sharing it online so that parents can get better results for their kiddos and just have happier and healthier kiddos. So thank you very much.
Thanks, Jay. It's been a pleasure.
Hi, it's Dr. Jay again, and I have a quick request for you. This is something that would really help me out. If you've been enjoying this podcast, either this episode alone or you've listened to others as well and you've enjoyed it, please, would you rate and review the podcast in iTunes for me? That would really help us out, because the more reviews we have there and comments, it shows other parents the value that they can get out of listening this, and hopefully learn and get educated and empowered in the same way that I hope you have. So it'll only take a few seconds. If you just go into iTunes, search for the Healthy Births, Happy Babies podcast, go under reviews there, give it 5 stars, write some comments there. That'll give me great feedback of what you like about it. But also, more importantly, that gains more exposure for the podcast in iTunes, so more parents can come across this information and have an easier way about things. So thank you in advance for doing so. I really appreciate it.